The city of Sanford wants to keep its streets and trails clean from needles, but advocates believe the way they are planning to clean it up really opens them up to more risk.
Pearl Small spoke to both sides about the debate over changing Sanford's needle exchange program.
Here at main access points in Sanford, you can exchange one needle for up to 100 clean ones. But city officials believe the people getting these needles are then using them and then leaving them on the ground or in other places around the city.
It's just like a normal mailbox.
Main access points recently bought this syringe disposal container as part of an attempt to work with the city towards a solution on needle waste.
And we don't want to see the syringe litter either, but we want to make sure that everybody's protected and harm isn't caused. I started doing this program about 2 years
Nikki Butler, who helps run the syringe service program, is worried about the city council's vote Tuesday night that would change the exchange ratio, only allowing people to get one needle back for every one they return.
We want to make sure that everybody's protected and harm isn't caused. I just changed it out.
Since the 1-to-100 ratio was introduced in 2022 under CDC guidelines, Butler says they've been able to provide important intervention services and decrease disease transmission.
There's no exception to the fact that harm reduction is a very positive thing.
The resolution really
City Manager Stephen Buck doesn't deny the science behind it, but believes cleanup efforts haven't matched the increase in needle supply.
So what our community is responding to is direct observations.
Buck says in the last couple of years, they've seen an increase in needle waste on their streets and hiking trails. The CDC has advised the council against this solution, and Butler believes it may actually have the opposite effect.
You're going to see more syringe litter because they're going to need to hide them to turn one in.
But Buck says they've asked the CDC to come up with a better plan, but believes the agency's response has not been aggressive enough.
There is a public health crisis for inappropriately discarded needles that's being left unaddressed for the 25,000 other people in our community that risk exposure.
While most in the community want to see the streets cleaned up, some worry this solution might be a step backwards.
I see a lot more hospital trips. I just feel like it's going to draw a big line.
And if the city does vote yes, Buck says it'll be like a 3-month trial run. And they're open to changing it if the main CDC or syringe providers can come up with a better solution. In Sanford, Pearl Small, News Center, Maine.